First edition begins this half hour with a really important topic we want you to focus on. When people are exposed to extreme heat, they can suffer from potentially deadly illnesses such as heat exhaustion and heat stroke. Dr. Salim Surani joins us live to discuss this further. Dr. Surani, I want to focus more on people dying at night because people don't know how common it is, but it is a true concern.
Good morning, John. Glad to be here. You're absolutely right. We are very aware of the hurricane preparedness. We are very aware of if there is a blizzard or a snow coming in that region because we don't see it every day. But the heat comes every season. This season, it's very different because we have a heat wave coming in all the way from California to even going towards the Atlanta. And the heat index, as you mentioned, is much, much higher than what it is. What it means is that if you are not taking care of yourself, if you're not aware, if you're not recognizing the early signs and symptoms, we end up in a lot of trouble and people can die, especially people who are elderly, people who are little kids, people who have some chronic illness, they have immunity issue. They are the most vulnerable population. It doesn't mean that people who are young, they are safe. If you're a construction worker out there, and if you don't take some of the precaution, you can end up in having a major challenges.
I'm reading that, and from one of the latest studies that takes it up to 2018, that African Americans tend to be at a greater risk for heat-related deaths.
That is true. Some of the racial discrepancies are there where they're more prone to having a heat stroke and heat exhaustion. It doesn't mean that the other ethnics are immune. Hispanics are also falling behind them. And again, you have to know what are the signs and symptoms. Some of the things are you feel very hot, dry skin. You can have muscle cramps, your muscles are aching. You can have nausea and vomiting, some headache. And if you ignore it and you don't quickly, hydrate yourself and replenish your fluid and electrolyte, which is lost, then you can start having confusion and mental status changes, and you can start having seizure, and that can be a very catastrophic thing.
Okay, Dr. Surani, you're going to be with Barbie in the next half hour further discussing this. Also, how on earth do you even know when you're going to bed that there are signs and symptoms to even look out for, things to keep in mind to make sure that, like you mentioned, our elderly and young children and those with mental disorders are properly cared for. Dr. Surani, we appreciate it. If you have a question for Dr. Surani, send us a text at 361-855-6397.